Hi, my name is Caitlin Williams, and today I'm going to demonstrate to you how to change an infant or toddler's diaper by state regulation or in a child care facility. First, you personally need, as the provider, need to wash your hands before you get out their diapers and all their things. So to begin, you wash your hands, then you get out their fresh diaper, tons of wipes, or as much as you think you'll need, and you need to get out the ointment. With the ointment, you need to put it on a clean paper towel or tissue so that you can apply it later. Also, if they got anything outside of their other clothes, you need to get new clothes to put on them. So after you assemble all the supplies you need for the child's diaper change, you go get the child from their setting, put them up on the table, and make sure you have one hand on them at all times so that they are not falling off, rolling around to get hurt or anything. So after you do that, you need to take off the diaper and grab some wipes. When you use wipes, you have to use, for each wipe, you have to wipe with one wet wipe. So wipe it and then put it in the diaper, wipe it and then put it in the diaper. Or as many times as you need to, you go ahead and wipe with a clean new one. Roll up the paper towel, make sure you keep one hand on the child, and dispose of it. After you do that, you need to take a wipe and wipe your hands off, throw that away, and wipe their hands off and throw it away. After you do that, you need to get the new diaper, slide it under their bottom, and grab your ointment paper towel and apply that if needed. It's not often needed, but some parents like to have their child have it every changing. After you put that on, you need to dispose of it also. So after you do that, you need to put the diaper on, strap it, fasten it, and after you're done doing that, you redress the child, if needed, or if you, a lot of times they like to kick and move and squirm, so sometimes their pants slide off their legs and you have to re-put their pants on and whatever else you need to do. So after you dress them, you need to wash their hands. Now you can, if you can't get to the sink, or say an infant, you can't really hold them up because you need to support their neck and you just need to support their body. You can take a wipe once again and wipe their hands off and then throw it away. After you do that, you need to take the child, put them back into their setting, and then to take care of the changing table after they're done, you need to spray it with soapy water and wipe it down. Then after that, you need to spray it with disinfectant, or at my facility, I'm sure many others use bleach water. You spray that on, and you can either let it sit for 2 minutes, because it's easier if you let it sit for 2 minutes, because then if you have another child you need to be changing, you're not waiting as long. Or you can, after letting it sit for 2 minutes, and wipe it off, or you can spray it and just let it air dry if you don't have any kids to change. After that, you personally, as a provider, need to wash your hands so that you aren't contaminating anything else and spreading germs. Wash your hands, and then after that, you get the child's daily paper and write down what was in their diaper, and if you used ointment, what their skin looked like if needed. So it's pretty important to do that because the child can get sores and diaper rash and all that kind of nasty stuff, and nobody wants their child to have that because I'm sure it hurts. It's important to change them every 2 hours so they don't get diaper rash and red and all that soreness. And at our facility, you are to check them every 2 hours and or change them every 2 hours and check them every hour so that nobody gets that sore or anything. So, hopefully you learned something today, and thank you for your time.